So, in contrast to regular cataracts that typically happen as one gets older in life, after the age of 60 or 70, congenital cataracts are present at birth. And that's where the natural lens of the eye is cloudy. And that can happen whilst a baby is developing in utero or immediately after birth. So that's where the natural lens becomes cloudy at birth. So the reality is, as ophthalmic researchers and surgeons, we don't fully understand the causes of congenital cataracts. We certainly know that there are significant genetic factors that play, and we think it may be due to genetic mutations that exist in a baby's DNA that cause them to have sort of lens becoming cloudy at birth and developing congenital cataracts. So classically, with congenital cataracts, developing babies have very poor vision. And now how that would manifest is that it may mean that a baby may be not fixing and focusing. They may not be looking at specific, objects, for example. They're not recognizing a mother's face or smiling. And as well as that, they may have what we call visual inattention. So they're not directly looking at something. If they have a congenital cataract only in one eye, it may result in head turning. So they're moving their head to a specific place so that they can see out of the better seeing eye, as it were. So generally, the best treatment options include surgery in the young child. And this is because it's very important to optimize the amount of light going into the eye to allow the visual system to mature and for the brain to develop the visual system. Otherwise, what can happen is you can develop a condition called amblyopia, also known as lazy eye, where the eye does not develop fully and the vision is not strong in that particular eye. Therefore, it's paramount that patients with congenital cataracts are seen very promptly by a pediatric or children's ophthalmologist, who would often recommend surgery is performed, where the cataract is removed and in many cases an artificial lens is inserted. So patients can identify, parents rather, can identify congenital cataracts in their children by looking at the eyes firstly. Now, sometimes if the natural lens of the eye is already very cloudy, that can actually be visible to the naked eye without actually looking with a magnifying glass or a similar type of ophthalmic instrument. And that's where the natural lens, which will be within the pupil of the eye, is often cloudy and white in color. The second thing is based upon symptoms. Patients might show signs of inattention, an inability to fix and focus, not recognizing, looking at objects, or not recognizing faces or smiling when they look at mother's face, for example. And those may be signs that there is a visual problem which could signify a congenital cataract. Now, if a parent suspects that their child may have this condition, it may be worthwhile taking a picture of the eyes, sending that to their general practitioner, their GP, or health support worker, who in turn can escalate that through to the general practitioner, and the patient can be referred to a pediatric or children's ophthalmologist for a very prompt assessment.